Hello, and welcome to Mental Health Matters Podcast. I'm your host, Liz Lang, and I'm here with Dr. Mark Burton. In this podcast, we will talk about all things mental health. Thank you so much for joining us. Hey guys, Liz Lang here with Dr. Mark Burton, and this week we are going to talk about anger, specifically why anger. Why do we get angry and how do we deal with anger? So I thought we should pose a question that we've talked about before, but it always warrants a discussion, and that is why we have emotions in the first place, why they're important and what they are. Maybe we could even get into a little bit of where emotions originate. Where do they come from?
Well, they're in our brain. I mean, that's where they originate. But I need to listen to this particular podcast again, but because I just did a few days ago. It's, again,
Hey guys, Liz Lang here with Dr. Mark Burton, and this week we are going to talk about anger, specifically why anger. Why do we get angry and how do we deal with anger? So I thought we should pose a question that we've talked about before, but it always warrants a discussion, and that is why we have emotions in the first place, why they're important and what they are. Maybe we could even get into a little bit of where emotions originate. Where do they come from?
Well, they're in our brain. I mean, that's where they originate. But I need to listen to this particular podcast again, but because I just did a few days ago. It's, again, one of Andrew Huberman's, and his guest is a psychologist from Toronto. I think the last name is Barrett. And so if people want more information on emotion, her whole field of study is about emotion. Now, what she is saying, what they found, I believe this, I think there's a lot of misunderstanding around emotion, but that it originates in our body and that our mind is responding, or our brain is responding to physiological changes. And, it kind of ties into a lot of what we talk about, that there's so much that happens in our bodies physiologically that then causes us to think in a way or behave in a way. And apparently emotions are very much the same way. The other thing about emotions that I thought was interesting in this particular podcast is that our brain it's an organ that anticipates or make comparisons to patterns. So, for instance, when we feel a certain emotion, our brain is actually thinking about, when did this happen before? What did I do then? What is it like? And so there's this whole process going on that then causes us to have that emotion. Now, I like a simpler approach just because I think it's easier for me to understand. I think that we have evolved with emotions. So yes, I ask this often of men who come into the office because I often hear men say, well, I don't have emotions, which certainly isn't true.
Yeah, we all do.
I think what they're really saying is, I don't know how to express my emotions. And so I try to get them to think about what's the purpose of emotion. And I think for whatever reason, it helps us survive because it gives us information about what's going on in our world. So there's a reason we have emotions. And I believe this, whether you believe in evolution or not. If you believe in a higher power who designed us, I think it fits, in both circumstances, that the emotions are there because they help us to connect to other people, which I think is all, for me, is all about survival. They help us to connect with other people, and they also help to, might say, keep us safe. Give information about safety. So I think that for me, that's the simplistic explanation of why we have emotion. But if listeners are interested in the very complex way our brain handles emotions, then that podcast with Huberman and Barrett pretty helpful.
Yeah, and so correct me if I'm wrong here, but emotions are regulated in the prefrontal cortex. Is that correct?
Well, yes, and they reside in the limbic system too, the amygdala. When I talk to, individuals and couples, here's one of the problems with the amygdala and the limbic system. So if you have let's talk about trauma, and as a child you have a traumatic experience, and that emotion, say the fear, then where it's going to reside in the brain is in that limbic system, which is different than what you said. So I'm not disagreeing with what you said.
Okay.
The regulate, because you talked about regulation.
Yes.
which is certainly in the prefrontal cortex. But
Yeah.
for me, when I'm working with clients, because they often are triggered, and we've used that word so many times in so many
Mhm.
different episodes,
Mhm.
that there are events that trigger us, and then we feel that emotion really very strongly, even though in that moment you know that you probably shouldn't feel as strongly as you do.
Mm.
But it's almost always about something from the past.
Yep.
And the problem with the limbic system has no temporal component. And what I mean by that is it doesn't know if you're 5 or if you're 35,
Yep.
your brain. And so if you're triggered, that emotion, that feeling is going to feel just the same as if
Yep.
when you were 5 years old, terrible traumatic thing happened, and then you're triggered, you're going to feel the same way.
And that is where you have panic attacks
Yeah,
because
exactly.
you're triggered. And it's not that you're wrong and it's not that, you're doing something wrong. It's your mind.
Hmm.
And when people say it's all in your head, well,
Well, that's true.
it is all in your
Yeah,
head, but that
yeah,
doesn't make it any less real than a broken arm
or less valid,
or less
right?
valid. Yes.
But I think that, and a little bit off topic, well, emotions in general, but a lot of people come in and they don't want to feel as strongly in the
Mhm.
present, like 30, at 35, they don't want to be as afraid as they were when they were 5. So we work
Sure.
on that,
Hmm.
trying to help them to stay more in the present. And so I think you can
Yeah.
change that, but you just have to first be aware of what's going on. A lot of people
Right.
don't understand that's what's happening.
Hmm. Yeah. All right. So all emotions are valid, every
Right.
single one of them. They all matter. It's just our mind's way of giving information. And as I've thought about the various emotions, the only one that I can think of that is maybe not helpful or that you should really avoid is shame. And
Right.
we've
We've
talked
talked.
about this, yeah, this idea of shame versus guilt. Shame is
Hmm.
internal, I'm bad. Guilt is my choice was bad. Guilt is actually a very helpful and
Hmm.
good emotion. It doesn't
Hmm.
feel good, but it's a very important emotion. And I think the same thing can be said about anger. I mean, anger is not necessarily emotion that people like to feel, but there's a reason for it. And so, feeling angry is your body's way of saying something is going on, something needs to change, something isn't right. Now, I think most of us listening from a very young age have been taught that to feel angry is wrong, that it's wrong to feel anger. And I even catch myself doing this with my kids sometimes is when they get angry, I immediately want to shut that emotion down and change it.
Yeah. I think
And
there's a huge cultural component to
yeah,
how we think about anger. Because you're
yeah.
right. Because I think there are some cultures who are more comfortable with anger.
Mm-hmm.
And
Okay.
I'm thinking about, this is a generalization, but sometimes it's true. Italians tend to be more
Mm-hmm.
comfortable, I think, with emotion. And I think I've mentioned before, maybe this, I was up in Yellowstone
Mm-hmm.
and in one of the general stores, there was an Italian family and something happened. I have no idea what was going on, but man, were they yelling at each other and angry. I mean, you could tell. And they were
Wow.
just going at it. 10 minutes later, we're outside and you see the same family
Uh-huh.
and nothing, nothing would have happened. I mean, they were just all happy and, connected. And so it's the way that particular culture sees
Mm-hmm.
anger as not being as terrible or dangerous. So you're right. I
Interesting.
think in our culture, we certainly are taught
Yeah.
that. It's true in some religious traditions as well. I don't think all of them necessarily, but some religious traditions, it's not okay to be angry.
Mm-hmm. And I don't think that's correct. I think that it is okay to be angry. It's what you do with your anger. Because, and I remember hearing in church, we choose to be offended. And I said, but what if someone is really trying to offend me? Like, if someone
Yeah.
comes up and smacks me in the face, am I just not supposed to be offended by that? Well, I think that if someone is genuinely trying to offend you, it's okay. It's okay to feel the emotion, but what are you going to do with that emotion? Are you going to, and what the church was getting at, or what the teaching that their church was trying to get at is, are you going to let that offense get to you to the point that you stop coming or that you have some sort of negative reaction towards this person or it sours some relationship? Or,
Right.
or
And
are you going to resolve it and choose to just, let it go?
that's a big misunderstanding that in fact, I heard it from a client who had another therapist tell him this, that you choose to be angry. and if you're
Mm,
speaking more generally about emotion, I don't
hmm.
think we choose to feel
Yeah.
anything. I
Hmm.
think it's a response. And you're right. I mean, if you're talking about, that emotion of being offended, it's not like you choose to be offended.
Yeah.
Something has triggered you, and that's the emotion you're feeling. And it's all
Hmm.
about the behavior. What do you do
Yeah.
with it?
Yes.
And so I think for our listeners to really understand, you aren't choosing to be angry, you aren't choosing to be happy. I mean, there are things that make you happy, there are things that make you sad. You don't
Yep.
choose to be sad. I mean, you
Hmm.
may choose to stay stuck in the sadness, but again,
Yes.
to me, that's just behavior. Or
Yep.
you may choose to stay stuck in the anger, but again, we're just talking about behavior.
Yeah.
I think one thing that's important to talk about at the start here is the idea of what we call primary emotions and secondary emotions. Now,
Mm.
I don't know that I don't think there's any debate on this because there's certainly good research evidence that says often, not always, but often anger is a secondary emotion.
Hmm.
And so what we mean by that is that there's some other thing going on, like either you're sad or you're hurt or you're feeling vulnerable. And I don't think this is a conscious process either. But we generally don't like feeling vulnerable. I think this is especially true for men. I see this all the time in men. And so, I mean, if you think about culturally, it's not that acceptable for men to feel vulnerable or sad or powerless. I see it when men feel powerless and they shift it into being angry because anger helps them feel powerful
Hmm.
and anger helps them feel not feel vulnerable.
Hmm.
And so that's why sometimes it's labeled a secondary emotion, that there's really something underneath there's something else going on underneath. But that again, I think culturally this is especially true for men. It's okay to be angry. I
Yeah.
don't know if you think that's accurate as well.
I do. Yeah, no, I think it's okay to be angry. In fact, one of the things that I've been working on, in terms of just a parenting skill is so if my kids get angry and they react, oh, and like I think this was like weeks ago, and my daughter, she didn't like something and she goes, ugh. And it wasn't that quiet though, but she made this
Mhm.
big fuss about it and stomped off to her room. I let it go. She's
Yeah,
angry. She's
right.
expressing that anger. And in my childhood, that behavior wasn't okay. My parents would have said, no, that's not how we act. Don't do that. And not that my parents were wrong.
They weren't trying to harm you in any
No,
way.
no,
As we've said before, I think most parents do the very best job that
exactly. And
they
and that
can.
was and that was my parents. But, they absolutely were trying to do the best they can. And now what we have said is, and we tell our kids this, it's okay to be angry, but what's not okay is for you to disturb the entire house. So if your anger gets so big that you're screaming at the top of your lungs,
Yeah,
then you're
go
disturbing
go
you're just
well, go scream in your room, or
into a pillow or
or
something.
pillow
So
something.
like, yeah, we have no problem with you being angry. And another thing too is if you're angry, that doesn't mean you get to speak unkindly to somebody
Right,
else,
right,
right? And so, these are skills that we can help our kids learn. And it is our job as parents to help kids learn to regulate their emotions because they're not good at it. And
right.
I think another thing too, that parents often do and that we're probably trained to do from a young age is, and if you think about it, it totally makes sense, is because when your child gets angry, what does the parent often do? Stop it. They get angry at your anger.
Yeah.
And that just kind of that feeds off of it. And
If you think about the parent's anger, see, this to
Mhm.
me, I think is a secondary emotion. They're feeling in the moment powerless,
Okay.
right?
Yeah.
They want to change it. They don't know what to do, or helpless because they don't know what to
Hmm.
do.
Yeah.
Right. And so I think that the anger is often used to mask other emotions, and
Okay.
but not all the time. So
Yeah.
anger can certainly be a primary emotion. In fact, there's a researcher. I started reading about this, and if I read this in graduate school, I'd forgotten it. A guy named Paul Ekman who wrote a book called Atlas of Emotions, and he thinks there are six basic emotions,
Okay.
and he describes those as being anger, disgust, fear, happiness, sadness, and surprise. And so,
Okay.
and I think the point in him, labeling anger is it's felt by everyone at one point or another,
Hmm.
and it's completely valid as its own emotion. And so, when I'm talking about primary and secondary, I want to be clear that anger is often the primary emotion,
Yeah.
but it is very often a secondary emotion. Following up on something you said about kids, I think I've mentioned Gottman's emotion coaching. He calls
Mm-hmm.
it emotion coaching. He also calls it the heart of parenting.
Yeah.
And his whole goal is to teach children to be aware of their own emotions and to
Mm-hmm.
label them and to
Yeah.
give them that vocabulary. Because I often find with men, especially, who come in, and again, I'm making a generalization, but it's often true that men come in and they don't have an emotional vocabulary. And I think that,
Mm-hmm.
so we cannot express or often even be aware that we're feeling an emotion unless we have a word to describe it.
Yes.
And so the way we talk about emotions or even the way we experience emotions is limited by our language. And
Mm-hmm.
again, from this podcast I listened to, she brought up just an example of, I think it was in Turkey. There's an emotion. They actually have a separate word for the emotion that is combining anger and fear. And so,
Mm.
and it's a whole separate emotion that we would not have. And the only reason we don't have it is because we don't have a word that
Interesting.
describes it. And so language is very important in how we experience emotions. One of the first things I try and do with people who are having trouble expressing their emotions, I give them this whole list and of emotions. And so the goal is to increase their emotional vocabulary. And
Yeah.
once you increase your emotional vocabulary, you're comfortable with it, then you start being aware
Mm-hmm.
of what the emotion is you're experiencing.
Yeah. And going back real quick to, this idea of parenting and emotion coaching. And, one of the things that Gottman recommends or someone has recommended is just start throwing emotions out there and seeing what sticks. Validating,
Right.
right?
He does that.
Yeah,
Yeah.
okay, that is Gottman. So he's like, oh, I can see how angry you are, or I can see that you're frustrated. I can see you're upset. Now, I do this as a parent, and I can tell you sometimes they just respond with anger, or they just respond with, no, I'm not. My kids do
Well,
that all the time.
which is fine
It
because they
is.
will. But often, as their emotional vocabulary grows, then they might say, "Mom, I'm not angry. I'm whatever,
Yep. Yep.
frustrated, or I'm something else."
Hmm.
And
And yeah, when you have a kid that is angry, the very best thing that you can do is stay calm.
Mhm.
Now,
Oh
that's
yeah,
hard as a parent. I'm not saying that it's always that it's always easy because kids are so good at pushing those buttons and they're trying to bring you into their emotions or bring you down to their emotional level. And so the best, quickest way to help a kid re-regulate is for you just to stay calm in the moment.
right. And then you have to decide, okay, how are you going to approach this? Now, I think
Yeah.
this idea of how do you handle someone who
Hmm.
you're with who gets angry, but it can be a partner, it can be your spouse, it can be any other adult.
Hmm.
And I think this is hard to do in the moment if you're experiencing the anger, but with your child, it might be easy. With a spouse, it's a little bit harder to feel curious
Mm.
about the anger and to try and say, I can tell you're really angry. I'm wondering what you're angry about right now.
Hmm.
And so you start a dialogue and getting them to talk about it. I think that works with children just as
Yeah.
well as it does with a spouse or an adult child or someone you're with who gets angry. And so you're right. You can only do that if you're calm. You can't say,
Hmm.
"Tell me why you're angry." I want to know why you're angry. You can't respond with anger because that's not going to work.
No.
But if you stay calm, because the questioning often helps them to understand what's behind it, and often what will happen is they'll get to the primary emotion. So in that
Hmm.
case, the anger might be a secondary emotion, and maybe they're feeling hurt, or maybe they're feeling embarrassed or vulnerable, or whatever it is. And if you're able to have a calm dialogue with them, then often they get to that.
Yeah. So I think another thing that we need to talk about, going back to this idea of physiological responses, is sometimes it is just purely physiological. Sometimes your blood sugar's low, and
Oh
sometimes
yes,
sometimes you're
angry.
hangry. Hangry, yeah, hangry is. I mean, I think they added that to the dictionary because it's a real thing. I mean, because when you're hungry, you genuinely are more irritable, and I want to start a new one, and that's tangry. I'm tired,
What
angry.
okay, tired angry, yeah.
I experienced that.
It's a really important point. I have this example that I thought of that happened to me,
Hmm.
and I'm trying to think if I'm a little embarrassed to say it. So I'm cooking. I'm at the stovetop, and I think I'm working with oil. And when
Hmm.
oil gets hot that comes out, that can really hurt.
Yeah.
And so something happened that splashed oil onto my hand. There was quite a bit of it. It hurt because often pain can then cause an anger response.
Oh,
And
yes.
the embarrassing part is my dog was right down there. My dog wasn't doing anything, but
Mm-hmm.
man, did the anger come out against the dog. But the interesting thing, it was split second.
Yeah.
It was like physiologically, I flared up
Mm-hmm.
in this major way, and it exited and came out to the dog. And then after that, it was gone. Once the pain subsides. But
Yeah.
so you're right. So I don't know, pain and anger.
Angry.
we can
Yeah.
come we can come up with a whole tangry, hangry, pangry.
Yeah.
Anyway, it's important to realize that there are other things going on that can trigger that anger response
Mm-hmm.
physiologically.
Yeah, absolutely. Okay, so let's talk about anger management classes.
Hmm.
That's kind of like a pop psychology thing nowadays is man, that guy needs anger management. And I don't know, are those still a thing and are they effective?
Okay, two good questions. Yes, they're still a thing. I think most often, though, from my experience, you're court ordered into doing it. So if you think about the court
Mm-hmm.
and say you're there for domestic violence or something like that, then often the court has no idea what to do. I mean, so you
Mm-hmm.
can define jail time or a fine, but they want to do something to try and help you. And what they do is you have to go to an anger class. We get calls we don't have anger classes. We get calls all the time for people saying, "Do you have anger classes?" And they're court ordered. Now, are they effective? I think, like anything, they're only as effective. The anger class is going to teach you
Yeah.
to do certain things that we'll talk about that people should do, like increase your activity, exercise, do some sort of meditation, distract yourself. But most people who go to anger management classes aren't going to do those. So
Not when
are
it's
they
court
effective?
ordered.
Generally not. They're
Yeah.
just there to get their certificate so they can say, yeah, I completed my court ordered anger management class. But I
Mm-hmm.
think if you really want to change that, you can use those same techniques that you might learn in an anger management class, and then they can be effective. Because, how to handle your own anger, we've talked about these things before so many times as far as calming yourself physiologically, which is
Yeah.
what you're doing, because we use the term flooding often.
Mm-hmm.
And all that means in the psychological world, flooding is hormonally you're changing, adrenaline, your heart rate is going up, and those are all things that happen when you're angry. And so if you really want to be able to control your anger, which then follows that you're going to be able to control your behavior, you have to learn how to calm yourself. And a lot of people don't really know how to calm themselves in the moment.
So
It's
what
a
is
really good skill to have. Look, and in fact, when we talk about kids, I think it's a great skill for parents to be able to teach their kids how to calm themselves.
well, so what would that look like? How do you calm yourself?
Well, I think that, if you can see that your child is angry, and I was going to mention before, like with your daughter, when she did the huff and puff and goes off on the continuum, I think and frustration bound, get bigger until at some point it crosses over into anger. And so it's important to realize, your child or your spouse may just be frustrated, but
Mm,
it looks an awfully lot like anger, but it
yeah.
may not be. It may just be frustration. And I think you can even talk to your kids about what calms them. Does going and drawing, find does going and reading a book,
Mm-hmm.
going and reading might calm them. But you talk about it and you say, here's the goal, is for you to calm down. I think that kids, probably at a fairly young age, can understand you don't even need to go into the details that something's going on in their body. You can
Mm-hmm.
explain the physiology, and that's really important for adults to know. Information like that is always really helpful. And so if you explain, here's what's going on, I think that also helps the child to move away from the shame,
Mm,
because it's not me bad, my body is reacting to this, whatever's going on. And I think
mm-hmm.
if you help them understand what's going on with their emotions, and that it's normal to feel that way, how do you then handle it so that you can calm yourself down? And I think that's going to be different for every kid, different certainly for every adult, to figure
Mm-hmm.
out what it is. So when I'm working with adults, we're always talking about, what do you do? To Is it a hot bath? Is it a hot shower? Is it to go out for a walk around the block? Is it to go listen to some music? Something like that. I always stay away from, like, they may say, well, I'll go turn on the TV. And I really trying to discourage that big time. I don't think that
Yeah.
it's a distractor more than it is a calming influence that just distracts you from what's going on when what you really want to do is really change your physiology. So exercise, of course,
Mm-hmm.
go
Yeah.
do some aerobic exercise, and then certainly meditation
Yeah.
is really important too.
I've certainly experienced that. Curtis and I went on a bike ride together and we experienced some conflict during the ride, and man, did I have a good ride. I,
Okay.
ch- I channeled that anger and I really went. I pushed
Uh-huh.
myself. I was like, oh yeah, I didn't talk to him the rest of the ride, which was fine. But it was a really good ride for
Okay.
me.
So me being a couples therapist, my question would be, did you repair after Liz?
Oh yeah.
Good.
Yeah.
Okay.
Yeah. I mean, yeah, we
That's all.
repaired. Yeah.
That's all that matters.
Yeah,
Really.
and really, yeah, that's all that matters. But that's another important point to bring up is, when you do get angry, know when to walk away. I think
Right.
that's another really, and it's an important skill to help your kids learn. So I was thinking of, as you were talking about, calming people and what helps you calm. My daughter calls this her secret weapon. My middle
Hmm.
daughter, back scratches,
Oh,
and
yeah.
yeah,
Well, I
and
mean, think of the physiological
yeah.
change that comes with that. Yeah.
And it's gotten to a point where obviously we know, we can tell when she's about to get worked up, and I can just say, "Do you want some back scratches?" And usually at first it's no, because she's too caught up in the anger.
Yeah.
But eventually she just says okay, and she just kind of flops over me.
Okay. Well, so you already know what it is for her.
Oh yeah,
How to
yeah,
calm it. Just a back
yeah.
scratch. See, and kids are going to have that. They'll have
hmm
something that will help calm them.
She told me that she invented back scratches once.
She did.
Yeah, she thought she invented back scratches. Yeah, I thought that was really cute when she said
uh,
that. All right, so let's talk about dealing with other people's anger. And we've touched
mhm.
on this briefly about, going into this idea of I can see you're angry and, tell me why. I want to know why. And
So I never ask why.
oh, okay.
Okay. What is it that's making you angry right now? It's a very different question because if you say why, it generally brings up defensiveness.
Mm,
So why, like if I say, why are you angry right now? The response for a lot of people is going to be, okay, now I have to prove that I have a valid reason
hmm
to be angry.
hmm
Whereas you can avoid that by just saying, I can tell you're angry. I'd really like to know what you're angry about. What's making you angry, right? And then you just listen. And so do you
hmm
remember we've talked about this through several podcasts, the idea of listen and understand,
Yep.
have the validation and the empathy. I think that's what you need in that moment because even though you might not agree with the reason the person is angry, for you to be able to listen and
hmm
get it from their perspective and say, you know what, I understand. It makes sense to me that you're angry. It's going to bring it down. It's just going to calm them. And even just the process of talking about it will be calm for them. So I think mostly it's about listening, not making any judgment, understanding well enough that you can validate.
Yeah, exactly. And so now I want to switch gears a little bit and talk about maybe when that anger crosses over into when it gets too big, when it gets to be too much, right? And
And
maybe,
what do you mean by that? Like what would be too big?
well, if you come in and you're yelling at somebody for something that maybe that was unintentional, or if their reaction is unwarranted, right? Or I don't know. I mean, obviously, if somebody ever starts to get any sort of physical in anger, I think it's 100% appropriate to involve the police at that point, because this person obviously has some serious anger issues. But I don't know, maybe just, I don't know, if someone is screaming and yelling and you're just
So
uncomfortable.
yeah, and so I think that you mentioned this. So you didn't use the term timeout. That's what I call it. Where
hmm
and Gottman would say that any time your heart rate goes over 100 beats per minute, you really need to consider taking time out. And so if someone's coming in and yelling and screaming, their heart rate is definitely over 100
Yeah.
beats per minute. And so what you really need to do is, I mean, it'd be good if you're the one yelling and screaming to say, I need to go calm down. I need to take a time out. But
hmm
if you aren't able to do that, then whoever you're with, you are with, hopefully can say, we need to take a break. And make it clear, I want to talk to you and I want to listen to the reason you're angry, but I can't do it right now when, we're so escalated.
And here's the thing that I think people don't think about is when somebody comes at you angry and if they start screaming and yelling at you, you are going to automatically have a physiological response.
Yes, you are.
Your heart rate is going to
Absolutely.
start going up.
Yep.
And so just recognize that and be prepared for that. And it's okay to very firmly say to someone, stop.
Right.
I'm not okay with you talking to me this way. You are clearly upset. I'm going to go somewhere else because I'm not going to put up with this. That's a good self boundary that's
right.
kind of bouncing off of what we talked about last week is, I think sometimes people think that when somebody's angry and yelling at them, they think they have to just take it. And
right.
you don't.
And I have one client in particular that I know that relative treats them that way. And it's really hard for this person to set that boundary and say,
yeah,
I'm going to hang up the phone right now and call me, we'll talk later, or go away and talk later. But you're right. I think it's a really important boundary to have, because if you let them yell at you, I think it makes you feel less than to be treated that way.
Yeah.
And if you set the boundary, then I think that says something internally about yourself. I feel good enough about myself that I'm not going to be treated that way.
Mm-hmm. Yeah. But what's hard to do, but what's not helpful is for you to start yelling back. And that is so tempting. Again, don't flood, don't go to their level, but absolutely stop. And if they won't, walk away. It's
right.
Totally appropriate.
But what you said is really important, that you'll have a physiological response.
Yes.
In being approached that way. And so I think if you have done your meditation and exercise, then that makes it really easier for you as the person who's experiencing it to stay calm.
Yeah.
Which you want to.
You're going to start to feel adrenaline. Your fight or flight response is going to be triggered.
Right. Yeah, it'll kick in.
Yeah. And so, I mean, be prepared for that, but, absolutely don't take it. Don't, you don't have to put up with it. And
so taking time out is really important if you're trying to control your anger. And there are these elements of taking time out that I think are important. One, to calmly say, we need to go calm down, so we're going to take a time out. I think the second element is to put a time frame on it. Let's go calm down for 15 minutes. Let's go calm down for a half hour. And then you come back together. Because if you don't, and then you try again. And if you don't do that, if you don't set the time limit, then to the other person, it might feel like you're abandoning them, or if I walk away, we're never going to revisit this. So I am not going to let you walk away because, I want to deal with this and it's important to me. But if you make it clear, 15 minutes, half hour, then we'll come back. Then it's easier for the person to let go calm down, and come back.
Yeah, I agree with that. And that is something that I personally would appreciate, especially if it's a difficult topic, right? Maybe it was hard for you to bring this up in the first place and this is escalated. You don't want to come it was hard enough to bring this up in the first place. I don't want to have to go through all of that anxiety again.
Right.
To get there. And so, just saying, all right, I am flooded. I recognize that I am too caught up in the moment here. I need, 10 minutes to calm down and recollect. Mature things to do, mature difficult skills, but mature skills to learn, to be sure.
Right. And so, you need to, if you're the one with the anger problem, you need to do something about it daily.
Yeah.
Don't wait until you get angry, but increase your aerobic exercise, do some sort of meditative practice. There's certainly guided imagery out there that are specific to anger. I know probably thousands of them. And so find one that really works for you, and then work at taking the time out if you need to go calm down, and then come back and start the dialogue.
Does counting to 10 really work?
Well, I think if you're standing there in the moment, depends on the level, I think, that you're at. Like if you're screaming, it probably doesn't. I mean, how are you even going to stop the count to 10? But I think, if you haven't escalated so far yet, you could say, let's count to 10 and breathe. I mean, you've got to have some sort of breath going on.
Yeah. Yeah. Because if you just hold your breath and count to 10.
1, 2, that's not going to work.
Yeah.
But, if you're counting to 10 and really focusing on your breath, I think some people, if they practice, can calm themselves down that quickly.
Yeah.
That's it. See, that's the skill that they would probably, like if you were going to an anger management class, they'd probably teach you the skill, do this. But the problem is people don't practice it. You have to practice it at the times when you aren't angry. If you're waiting until you're angry, it's not going to work.
Yeah, I agree. And, I don't know why this sometimes works with kids, but if you say, just, all right, let's take a deep breath. I mean, another important thing is when you're saying this to an adult is you can't say it the same way you would to a kid. Because if you say, calm down, take a deep breath. Okay, first of all, calm down is like the worst thing you can ever say to somebody.
Right. You don't want to say that.
No, but it's like, okay, let's just take a deep breath here. And for whatever reason, oftentimes for my kids, and sometimes they're too flooded and it doesn't work. But other times it's like, all right, let's take a deep breath and then we can talk about this. And again, it's regulating. It's just, it's re-regulating the system, because when you are angry, you're dysregulated, right? Your body, your limbic system, everything is all out of whack. And so breathing is a really great way to refocus and regulate yourself.
Right. And I think that's what a meditative practice does too, is to help re-regulate your system. And so, even doing a short meditation, like, Headspace has meditations that are 10 minutes long, but you can find them on YouTube, guided imagery that are 10 minutes long. So if you needed to take a break, you go do a meditation, you're essentially doing that, re-regulating your system.
Yep, absolutely. Okay, so next week we are going to get into connections and traditions. So because these kind of tie in hand. And so, we're going to talk about why starting traditions is important in families. And we're also going to talk about why it is so important to connect with people. But we're also going to talk specifically about connecting with your partner and why that is so important for long-term happiness.
Okay. Sounds good.
It's going to be a good episode, and we will see you all next week.
Have a good week, everyone.
Have a question for Dr. Burton? How about a topic you'd like us to cover? Send us an email at mentalhealthpod21@gmail.com. This podcast was produced and edited by Liz Lang. Music is by Audio Lounge.